Angular cheilitis, also known as perleche or angular stomatitis, is a common inflammatory condition characterized by soreness, redness, and cracking at the corners of the mouth. It can be a source of discomfort and embarrassment for those affected. It often presents as red or swollen patches, which may be painful or itchy. The condition can occur unilaterally or bilaterally and may persist for weeks or months if left untreated. In this video, we will guide you through the causes, signs, and symptoms of angular cheilitis, explore the diagnosis and differential diagnosis processes, delve into treatment and prevention options, share practical home remedy tips, and address frequently asked questions. By the way, welcome to our channel. Don't forget to thumb up and subscribe. Causes and trigger factors of angular cheilitis. Nutritional deficiencies. One common cause of angular cheilitis is nutritional deficiencies, particularly of B vitamins, such as B2, B3, B6, and iron. These deficiencies weaken the skin's integrity, making it more susceptible to irritation and infection. Fungal or bacterial infections. Fungal or bacterial infections, such as candidiasis, yeast infection, or Staphylococcus aureus, can also contribute to angular cheilitis. These microorganisms thrive in moist environments, making the corners of the mouth an ideal breeding ground when saliva accumulates. Allergies. Some individuals may develop angular cheilitis due to allergic reactions to certain foods, oral hygiene products, or medications. Allergens can irritate the skin, leading to inflammation and discomfort. Symptoms of angular cheilitis. The symptoms of angular cheilitis may vary in severity but often include persistent soreness or pain at the corners of the mouth, redness and inflammation, cracking or fissures, which may bleed or ooze, itching or burning sensation, dryness or flaking of the skin. Differential diagnosis of angular cheilitis. Angular cheilitis shares similarities with other oral conditions, making differential diagnosis crucial. Some conditions to consider include herpes simplex. Herpes simplex virus, HSV, infection can cause cold sores or fever blisters around the mouth. Unlike angular cheilitis, herpes lesions typically appear as fluid-filled blisters and may recur intermittently. Contact dermatitis. Contact dermatitis occurs when the skin comes into contact with irritants or allergens, leading to inflammation and redness. It can resemble angular cheilitis but is often localized to the area of contact. Oral thrush. Oral thrush, or candidiasis, is a fungal infection caused by Candida species. It presents as white patches on the tongue, inner cheeks, or roof of the mouth, distinct from the corners of the mouth affected by angular cheilitis. Treatment options of angular cheilitis. Treatment for angular cheilitis depends on the underlying cause and severity of the condition. Here are 5 treatment options for angular cheilitis. Topical antifungal creams. Antifungal creams are often the first line of treatment for angular cheilitis caused by fungal infections, such as candidiasis. These creams work by inhibiting the growth of fungi and reducing inflammation in the affected area. Examples of topical antifungal creams include clotrimazole, miconazole, and ketoconazole. Topical antibacterial creams. In cases where bacterial infections contribute to angular cheilitis, topical antibacterial creams may be prescribed. These creams help eliminate bacteria and prevent further infection. Some common examples of topical antibacterial creams include mupirocin, neomycin, polymyxin B, bacitracin, and clindamycin. Oral antifungal medications. For severe or recurrent cases of angular cheilitis, oral antifungal medications may be necessary to target systemic fungal infections. These medications are typically prescribed by a healthcare professional and may include fluconazole, itraconazole, and ketoconazole. Topical corticosteroid creams. Corticosteroid creams can help alleviate inflammation and discomfort associated with angular cheilitis, especially when redness and swelling are prominent symptoms. These creams work by suppressing the immune response and reducing inflammation. Common topical corticosteroid creams include hydrocortisone cream, triamcinolone acetonide cream, and mometasone furoate cream. Oral antihistamines. In cases where allergies contribute to angular cheilitis, oral antihistamines may be recommended to reduce itching, swelling, and allergic reactions. These medications can help alleviate discomfort and prevent further irritation. Examples of oral antihistamines include cetirizine, loratadine, and diphenhydramine. Before starting any treatment regimen, it's essential to consult with a healthcare professional for proper diagnosis and guidance. They can determine the underlying cause of angular cheilitis and recommend the most suitable treatment options based on individual needs and medical history. Home remedy tips for angular cheilitis. In addition to medical treatment, certain home remedies may help manage angular cheilitis. Hydration and moisturization. Keeping the lips hydrated with lip balms or petroleum jelly can prevent dryness and cracking. Proper nutrition. Consuming a balanced diet rich in vitamins and minerals can support skin health and prevent nutritional deficiencies. Avoiding irritants. Avoid licking the lips excessively or using harsh oral hygiene products that may exacerbate inflammation. Frequently asked questions about angular cheilitis. Can angular cheilitis be contagious? Angular cheilitis itself is not contagious, but underlying infections such as fungal or bacterial infections may be transmitted through direct contact. Is angular cheilitis painful? Yes, angular cheilitis can cause discomfort, especially when eating or speaking, due to the presence of cracks or fissures at the corners of the mouth. How long does it take for angular cheilitis to heal? The healing time for angular cheilitis varies depending on the underlying cause and the effectiveness of treatment. Mild cases may resolve within a few days to weeks, while more severe or recurrent cases may require longer-term management. Can I wear lipstick or lip balm with angular cheilitis? It's best to avoid applying lipstick or lip balm directly to the affected area to prevent further irritation. Opt for hypoallergenic or non-comedogenic products and apply them carefully around the mouth. When should I see a doctor for angular cheilitis? If angular cheilitis persists despite home remedies or worsens over time, it's advisable to consult a healthcare professional for proper diagnosis and treatment. Thanks for watching. Take care and stay safe.